Good afternoon, early evening, and welcome to Behind the Breath, the podcast from the American Association for Respiratory Care, where we take you inside the stories and challenges and opportunities shaping the future of our profession. I'm Monique Kimmel, AARC Vice President of Membership and Customer Care, and today we're focusing on a topic affecting so many of our members, stepping into leadership roles in respiratory care program education. Not only are these busy professionals responsible for curriculum and faculty, clinical sites, and the next generation of respiratory therapists, they're also navigating a constantly changing healthcare environment. It's exciting but overwhelming. To help us unpack all of this, I am thrilled today to be joined by Dr. Sarah Varekojis, Professor and Director of Clinical Education for Respiratory Therapy at The Ohio State University's College of Medicine. She's not only a highly respected AARCRT and educator, but also president of COARC and a mentor who has guided so many new program directors through these challenges. Today, we're going to talk about the realities of being the new boss, how to build strong programs from the ground up, and practical advice for thriving in those early years of leadership. Sarah, thank you so much for joining us today. Really
Thank you,
excited
Monique.
to talk through all of this.
Yeah.
Um, I'm going to go ahead and start with the question I always ask is sort of what drew you to education program leadership in respiratory therapy? And also, what are some of the things that keep you passionate about your work?
Again, thank you again for the invitation to be here today. But my journey into education program leadership really kind of was rooted in a desire to shape the future, and specifically the future of our profession, respiratory therapy. So, after several years of working at the bedside, I realized that the impact that I could have as an educator extended beyond the individual patient encounters that I was having. And it became about influencing generations of clinicians. And what keeps me passionate is seeing the students. They grow into confident, compassionate professionals, and knowing that the work that we do as educators directly contributes to the quality of care that's provided to the patients at the bedside. I think because our field is constantly evolving, being part of that transformation through education is just really energizing for me.
I know that you're experiencing some of that right now as you're
Mhm.
seeing the students just starting to go through that journey,
Yes.
which is so exciting.
Yeah.
If you think about the early days when you were just getting into faculty in educational programming, what were some of the biggest surprises or challenges that you didn't see coming?
So I think one of the biggest surprises really was how different teaching is from clinical practice. We do patient education and family education, caregiver education at the bedside. Um, and while there's a few, things that translate to teaching in a formal education program, I had the clinical expertise, right, from working at the bedside, but translating that into effective teaching strategies was a pretty steep learning curve for me, and I suspect for a lot of others as well. So I really didn't kind of anticipate how much time and effort it takes to work on curriculum design, student assessment, student support. That would probably be one of the biggest areas. And kind of what inspired me to go into education was a mentor who saw some potential in me to make that transition, and really encouraged me to pursue continuing my education and supported me through some professional development around how you develop curriculum and those kinds of things. His support and then the realization that I could really help others find their voice in respiratory therapy was kind of a turning point for me in my career.
It's great to hear that you had that
Mhm.
mentor in
Oh,
your
amazing.
career and throughout your career.
Yes.
And I know
Yes.
you yourself have been a mentor as well on many occasions. Um, one thing, I know that, we've spoken before, and sometimes you find a lot of the leaders in education programming stepping into roles with little or no guidance. What are some of the common mistakes or pitfalls that they can run into early on?
I think it's a common pitfall across people that step into new roles, lots of different new roles, is to try to do everything at once. And so I think new educators really feel some pressure to try to prove themselves quickly to show that they've got what it takes. And that, of course, can lead to some burnout and also some really important missed opportunities to develop some collaborations and some important relationships that can help support you. So those you cannot underestimate the importance of the relationships that you need to build. And that can be with other faculty members, including those that are outside of respiratory therapy. Higher education faculty are higher education faculty. So, but also relationships with your clinical partners. That's a different relationship now. And you got to spend some time building those. And then I think it's super important that you build a relationship with your students. Everyone has a slightly different philosophy on this. And I don't know that there's one right answer, but we tell our students from the very beginning that we're going to, we're investing in your future. You're going to become one of our peers one day. And so we pour a lot into that relationship, and that helps us build some trust. And that does take time, but it's foundational, and it's really worth that time and effort that you take. And I think the other thing that new program faculty and program education leaders need to really think about is not only focusing on maybe what is broken, but also recognize what's working really, really well, working well for your clinical partners, working well for your students, working well for you. And so listening about kind of where are those areas of strength and how can I amplify those, and how can I ensure that we're retaining those, right, that are important to our students and to our clinical partners, but then also then slowly start to work on those areas that you feel like maybe are broken or they need some work.
Well, that's great advice. I
Mm.
appreciate that. Thank
Yeah.
you. Now I know when it comes to curriculum development, that's kind of a whole different ballgame, and it's often like drinking from a fire hose. How do you help, or how do you advise prioritizing what to update and what to create first?
Um, I think it's important to start with the end. And the end of every education program is the student outcomes. So think about what students must know and be able to do, and how they should act by the time they get to graduation when they're transitioning into a professional role. So, and think very broadly about that, beyond just the NBRC exam, right? Taking and passing the NBRC exam. So, think about all of those qualities and how you want them to act and behave. And then from there, you really want to create a roadmap, or we call it a curriculum map, right? That determines where students are going to gain knowledge and skills, and then where they're going to demonstrate that they've achieved the ability to behave the way you want them to behave, right, in whatever circumstances that is. Once you've that takes a lot of time and effort, but once you've kind of developed that curriculum map or that roadmap, um, that really will help you determine where to focus first, which courses, which individual classes or laboratories, and even maybe which topics. You'll recognize that there's a topic that maybe doesn't have the thread that goes all the way through, right? And that'll help you figure out where you should spend your time to have the most impact. I do want to caution you, though, not to feel like you can overhaul everything at the same time. Again, pick out where are those ties that maybe need to be kind of followed all the way through first, and then you'll kind of be able to focus on others. I think it's also probably important um, to think about things like clinical reasoning as an example that really can have a very widespread impact across your curriculum and on your student outcomes, and figuring out how does clinical reasoning kind of weave through our program. That could be worth a lot of time and effort, and maybe focusing on improving that across all of the courses, or all of the second year courses, or whatever it is, would really be a good way to approach it, so that you're able to really hone in on something and focus on it and really follow it all the way through, versus maybe like the shotgun approach, right, where you're doing a little bit of everything all at the same time. So that would be my suggestion. So start with the outcomes. What do you want the graduate to look like? Work your way back and figure out your curriculum map to get there.
Now that is a great advice. Again, just
Thank-
being able to plot it out and
Yeah,
really see how everything ties together. So
right. Exactly. Exactly.
that's great.
Yeah.
I know some of the challenges also when it comes to education are recruiting and keeping faculty. It's got to
Mhm,
be tough.
mhm,
How do
mhm.
you go about building a strong, motivated team?
Well, I think it really is. I think building a strong, motivated team, actually, there's a lot of principles that are the same regardless of the setting. And so education is not a whole lot different. So culture matters, right? The culture of your university, your college, your school, your division, right? Really matters. And so faculty want to feel like what they're doing is being valued, and that they have support, and that they're part of something that's very meaningful. And so I think it's important to set pretty clear expectations, just like we do with our students, right? Pretty clear expectations for what does it look like to be successful in education. It's different than clinical practice, right? What to be successful in education looks different than being successful in clinical practice. And so articulating those things up front about the expectations. One of those, I feel like one of the real significant advantages to being in education is that you have the opportunity to take advantage of professional growth opportunities. And so helping people find those and figure out where they want to grow and then accessing those opportunities, that's an expected part of your role as a faculty member is professional growth. And then, recognize the small things, celebrate the little wins along the way. You know, all of that helps to kind of develop a culture of collaboration rather than competition. It should not be a competition, right? You should definitely be supporting each other. And I think the creating an environment that supports collaboration really creates a space for faculty to be innovative and to put their own stamp on the topics and the courses that they're teaching. And that's important, right? It has to be authentic to you as the faculty member. If you are trying to, teach a class that you've inherited from someone else, if anybody's ever done that before, it doesn't feel right. And everyone can tell, right? Your students can tell and your education leadership can tell. And so I think that's important. So, I also think that making sure that there's a space for flexibility and respect for that work-life integration are also key. Education, when you're working clinically at the bedside, you clock in and you clock out, and education isn't really built that way, right? So thinking about flexibility and work-life integration and setting your expectations around those, I think, are really important. And there are still a lot of educators that have some clinical ties that work clinically. Several shifts a week, one shift a week, a couple shifts a month, that kind of a thing. And so figuring out how do you, and that can be a really important part of your professional development as a faculty member. But how do you kind of mesh all of those things together? I think it's important to be flexible and to allow those things, right, that are going to benefit the students in the end. But that might mean that the work looks a little bit different, right, for everyone. So.
Now, again, great advice. And I think just having that support network,
Yeah.
just what you're
Yeah.
talking about, is critical, and
Oh,
having a
it's
great
huge.
onboarding program too, just so that they're not thrown into the position without some
Absolutely.
steps and support along the way. So
Yeah.
that's great.
Yeah.
Um,
Yeah.
I know that clinical placements are also a huge pressure point with regard to the leadership. What are some strategies to help the leaders secure some high quality clinical sites, especially with competition being pretty fierce?
Yeah, so we've talked a couple times about relationships already, and those are huge. So strong partnerships with your clinical sites really are built on kind of a mutual respect and a clear communication. I'll tell you, I've had some situations where um, I had a clinical site that I was really interested in recruiting, and our students were very interested in opportunities there. And the leadership at the clinical site did not really understand kind of what an education or what a partnership with an education organization looked like, and what did that mean, and didn't really understand kind of how everyone benefits, right? And so it takes some time, right, to build that relationship. You have to really kind of um, authentically engage with the site coordinators and the leadership at the sites and understand their needs. You want to be careful not to always just come to them with a need, right? Well, what are their needs, and what maybe can a partnership with your organization, how can it benefit them, right? And show appreciation for the important role that they play in student development. Our students spend at least as much time with our clinical partners as they do with us, right? And so that's a huge, they have a huge impact, right, on the students' development into a professional. And so I think there's if they have needs around um, continuing education for how to be a good preceptor, that can benefit them as an employer, right? Because they need to precept new employees and those kinds of things. But it also then benefits the students. So that's definitely something that I found that kind of understanding their needs and what they want, right, out of the relationship, so you can provide that. I think you can also involve the site sometimes in curriculum discussions, whether that's as part of an advisory committee, right? And definitely encourage them to be part of your advisory committee, or if it's a specialty, right? A neonatal pediatrics course, and so you want to invite some of the site coordinators to be part of those curricular discussions. And then also just being very responsive to feedback. sometimes I get feedback from a clinical site that they want XYZ, and I'm thinking, and immediately I'm thinking, we can't do that, right? But take a minute, right, and kind of really think about, well, since this is a partnership, right, how can we navigate this situation? And it might be that certain days of the week or certain hours of the day are really overwhelmed with students for our clinical partners. So maybe adjusting my schedule a little bit that can help align with availability that the clinical site does have. It could end up being an advantage for your program because your students have access to preceptors that aren't stressed and don't have 12 students they're trying to manage, all in one shift. So I would say be responsive to feedback, listen carefully, remember that it is a partnership, right? That you shouldn't just always be coming to your clinical sites with ones.
So there are just so many facets. I mean, this is just one of so many. I know respiratory programs space. I mean, there's the new tech, there's
Yeah.
the new practices. Everything's changing so quickly. How can you? What advice do you have for leaders in order? How can they help to keep their curriculum relevant without overwhelming the faculty?
I think it's probably, I would say it's all about pacing and collaboration. Again, I remember I said earlier, you can't do everything kind of all at once. And so I also think that no one person can keep up with everything. But as a team, right? As a team of faculty, and I know that there's a lot of programs, mine included, that really only have 2 full-time faculty, right? And so, but still, there's a team there, right? And you have your clinical partners are also part of your team, right? So you can definitely encourage faculty members to take ownership of a specific area. So maybe it's simulation, or maybe it's diagnostic, maybe it's content, right? It's diagnostics, or it's pediatrics, and then they become the go-to person for updates in that space. Again, in my institution, I am the pediatrics person, but I can't do it by myself. I haven't worked in pediatrics for a long time. So I'm the pediatrics person, but I do rely heavily on my clinical partners, right? And I spend a lot of time with them. But anything that is happening that's my area, right? And none of the other faculty um, take ownership of that, right? Now, if they hear something or see something, of course, I always love to help. But and I think that make sure that when you're doing regular curricular reviews, that you keep them really focused and manageable. And so you can't do all of it all at the same time. So you've really got to kind of focus in on, well, this year we're going to really focus on incorporating more of this or more of that. Use your advisory committee. And like I said, your clinical partners. They're often the first to see changes in our field. And they can help guide, right, for what could be most relevant for the students, or going to have the most impact for them in their near future as graduates. So I really do think not no one person can do it all. You've got to diversify and get some help from your clinical partners and your advisory committee.
And it's all about the building of relationships, just
It is.
switching,
It
especially
is.
when you're the new boss in town.
Yeah.
And
Yeah.
really being able to leverage those relationships.
For sure.
I know that some of the programs struggle with, balancing classroom and the clinical experiences. How do directors ensure that their student grads are ready for the realities of patient care?
Um, I think it really starts with intentional integration. So preclinical learning, preclinical experiences in the classroom and the laboratory should directly support what they're going to see and do in clinicals. Um, there's always a debate, right? There's so much to talk about, but you really got to make sure that you're focusing on the things that the students are going to need when they go to clinicals. Use case-based learning, simulations, debriefs, right, from those simulations to help make the students kind of make those connections between theory and practice. You need to talk to your clinical instructors and your clinical preceptors, ask what the students are struggling with, and then make sure that your classroom and laboratory preparation for clinicals is reflecting, right, those challenges that the students are having. You want to make sure that you're not just focusing on doing a checkoff on a competency, right? But you're really trying to build that confidence and that clinical judgment in the student as you go. And that does take some coordination, again, between the program and the clinical side, but it also takes some reflection on the student's part and on the faculty's part, right? That worked, that didn't work, and a lot of integration of that real world context, right, through those case-based learning and simulations. That I also think that you need to make sure that you're very clear with your students and with your clinical partners that it's called clinical education for a reason. Learning needs to continue, and it needs to be supported and augmented and really enhanced in that clinical settings. I say to my students all the time, and I say to my clinical partners, they only know enough to keep learning. When they get to clinical education, it is clinical education, right? They are continuing to keep learning. So,
No, really good point. And I know there were some, especially some challenges way back when we had COVID.
yeah,
A lot of challenges because of limitations and
yes,
being able to get the clinical experiences. And
right.
I'm glad we're more or less past that, and things are settling more into the rhythm of
hmm
what you're just talking about now.
Yeah.
Um, in addition to the clinical skills, I know there are also a lot of soft skills that students need. How do you bake those into the program as well?
Yeah. We actually call them essential skills. So that they're again, so that we make sure that we are clearly communicating to the students that these are not secondary or these are not, nice to have. These are essential. So things like communication, empathy, adaptability, teamwork, right, are just as critical as knowing your ventilator settings, right? And we tell the students that from the very beginning, and that's embedded into their assessments from the very first assessment that they do in our program. And so employers and your clinical partners will tell you that they really don't have any problem teaching people how to use a certain piece of equipment. But if graduates don't possess essential skills prior to employment, they're really probably not going to be successful. I complete evaluations or recommendations or references for employment all the time. And it's usually a third to two thirds at best. A third is about their technical skills, like you were saying, and then the two thirds is about their essential skills, right? And so that's really, really important to the employers. And you can weave them into every part of your curriculum, right? So include assessment of communication skills while you're assessing those clinical skills in a competency checkoff setting. Use role playing in simulations, right? If you're doing simulations anyways, have somebody play a role and practice difficult conversations. Include interprofessional education opportunities for your students to help build that collaboration and teamwork. The evidence is very clear, right? That interprofessional education will do that. So you can help students develop emotional intelligence and professionalism through a lot of those activities as well. And I think again, making sure that you are intentional. Don't assume that students are going to pick up these skills along the way. I think you have to be very intentional about ensuring that they are developing them right along with their kind of technical skills or clinical skills. So
And your point that it all just meshes together because it is
yes,
it is really about both.
yes, it has to be. Yeah, yeah.
I know that enrollment and recruitment has been a challenge and probably continues to be for a lot of school programs. What are some creative or proven ways that you've seen programs attract more students?
I think for a lot of people, storytelling is very powerful. I think so. My students are all very traditional college age students. I know that that's not the case for all student body, but I think that one of the things that kind of brings all of the different generations that we're trying to recruit from together is storytelling. So when a prospective student can hear real stories about the impact that respiratory therapists are making, they're more likely to see the value of the profession and maybe more interested in. You can use your current students to help tell those stories. Prospective students like to hear stories from people like them, right? So you can definitely do that. And then you can. I think the other thing that you need to do is make sure that you're casting a wide net, a wide recruiting net. Most programs will tell you that there's not one thing that works to fill the seats, right? So it's a little bit of this and a little bit of this and a little bit of this. So partnering with high schools, hosting simulation events, open houses, using your social media if you're able, right? Some colleges and schools won't let you, but to highlight the student experiences and those student stories that we were talking about can help. And some programs have had some success with kind of a grow your own strategy. So they have a partnership with a healthcare organization to encourage EMTs, patient care assistants, other allied health workers to transition into RT. So sometimes that works. I think just making sure that you're doing everything you can to make the profession visible and then relatable to an audience of prospective students is important.
And I know there's been a lot of work done also at the high school level and just really
Absolutely.
going back to bring more visibility of
Yeah,
the profession in general. So
absolutely. The ARC has done a wonderful job with that. Absolutely.
exciting, and hopefully we'll start to see more and more students
Yes.
gravitating toward this great profession. If you're looking at somebody and talking to somebody who is a new education program leader,
Mhm.
what would be some, if you could give me maybe a couple of tips, survival tips, when they first step into the job? What would those
Yeah.
be?
Yeah, sure. I would say the first thing would be build your support network. You don't have to do this alone. You're not alone, right? You need to make connections with other program directors, other faculty, and you can do that through your professional organization. And specifically, I would say join the AARC education section. Once you join, you're able to access expertise of many accomplished educators. And then you're also able to connect with others that are very new to their role, right? So you're going to have kind of like that support. People are going through it the same as you. And then you'll also be able to rely on others that have maybe a little bit more experience and have some advice for you. So each of those groups, right, that are part of this education section brings something very valuable to the table that you're really not going to find anywhere else, right, outside of the education section. And then a very closely related advice would be to attend the summer forum and or the international congress. Both have sessions that are just for educators, and I'd encourage you not to just sit in a seat in the room, right, for the education sections. There's tons of opportunities to make connections, make connections amongst the education section members, the speakers with the speakers. They can oftentimes help make connections for you as well. The staff of the AARC is there. I mean, it's just there's so many opportunities if you take advantage of it. So professional development is a CORC requirement for key personnel. So advocate, right, to attend those meetings as part of that. And then I would say probably next would be to prioritize the kind of the most important thing in an education program, which is the student outcomes, right? The accreditation standards, and then kind of your well-being, right? Um, Learn more about the NBRC annual school summary report and learn more about the COARC annual report of current status. Both the information about both of those is available on their websites. It's worth the time. I know it's not exciting reading, but it's really, really important, right, to make sure that your program outcomes, right, specifically the students, are going to be successful. And again, on the MBRC website, and then especially on the COARC website, there's lots of really, really good, helpful information that you can use right away. If anything, I would say on the COARC website, go directly to the accreditation tab and just read all of the resources that are there. And then I think probably, you know, I don't want to say it's I mean, maybe I'm on number three. I don't want to say this is number three because this is probably number one, but maybe to just wrap it up is give yourself some grace. You're learning a new role. You have expertise at the bedside, but you may or may not have possessed any expertise when you moved into this role in education. And so you're learning something new and you're not going to have all the answers right away. And that's okay. I would encourage everyone to just remember that making progress is more important than having perfection. And so each positive step that you take towards improvement is worth it and is important and should be celebrated. And we're not looking for anything to be perfect right from the beginning. So,
That's so true, and it's funny because, just hearing you say that, it's gonna be some trial and error. It's
oh,
gonna
a
be,
lot.
not everything that everybody does is going to be the same. Everybody's gonna have their own style and bring their own, personalities and their own learning objectives and all of that
Right.
into
Absolutely.
the role and make it their own, which is great.
Hmm.
Finally, just, kinda to wrap it up today,
Yeah.
if there are some new directors, some new educational program leaders listening today, and if they're feeling overwhelmed and frustrated, what words of advice would you have for them?
I would say you're not alone. I've been doing this a very long time and I still feel very overwhelmed sometimes. So yeah, you're not alone. And again, going back to the, developing your network. And so sometimes that again is going to be other respiratory therapy educators, but don't forget that your school, you have other faculty member, maybe they're in nursing or maybe they're in occupational therapy or, another profession, but they're kind of they're in this boat with you too, right? And so you're not alone. They have programmatic accreditation. They're responsible for student outcomes. They have to have curriculum maps, all of those things, right? So every seasoned educator was once a beginner, and every challenge that you face is an opportunity to grow. And so lean on that community, right? Whether that's local or also then again through the education section, through the AARC. Ask for help. When people post questions on the AARC education section, you'll get an answer. We're educators. We want to help, right? And then, again, give yourself that grace and celebrate all of your small wins, right? Go home and, I did it. This worked, or, that kind of stuff. And even if it's just one small little thing, all of my students passed a competency assessment today, right? So I'm going to celebrate that tonight. So what you're doing really matters, right? It's really important. So, and it's not just important to your students, but it's important to our patients, right? And it's important to the future of our profession. So keep just showing up and learning more every day, and trusting that remembering your why, right? Why you're doing this will carry you through those tough days. So
Great words of encouragement. Thank you for wrapping it up this way.
yeah, sure.
And that kind of wraps up today's conversation on Behind the Breath. A big thank you also to Dr. Sarah Varekojis for sharing her insights and encouragement with us. If you're a new education program leader, remember you don't have to have all the answers right away. Start with small wins, lean on your peers, and know that you're helping to shape the future of respiratory care in ways that really matter. For more resources and support, be sure to visit aarc.org, where you'll find some education, peers, and tools to help you and your students succeed. And to Sarah's point, also, FAARC has a lot of resources geared toward helping program directors, of course, as well. I'm Monique Kimmel, and this has been Behind the Breath. Thanks again for listening. Don't forget to subscribe, and we'll see you next time. Thanks again, Sarah.
Thank you.